So basically, I got emailed questions from the staff as to, what do you want to know that has not been addressed in these talks? Continuing technical issues. Anyway, so one of the questions that came up immediately, which is a great question because it is really big right now, is the idea of eating a gluten-free diet, following a gluten-free diet. Anyone in here following a gluten-free diet? Raise your hand. Okay, basically, the diet is based on the idea that certain people have an immune response to gluten. And as a result, when they consume gluten, their body produces, antibodies, and you end up with these horrible symptoms, things, that you would expect that involve the gastrointestinal tract. Basically things like diarrhea or constipation or bloating, but there are other symptoms associated with gluten intolerance that have nothing to do with the bowel, things like muscle aches and pains, general fatigue. People can even get rashes based on their response to gluten. So, as a result then, the diagnosis is actually referred to as celiac disease or gluten enteropathy or non-tropical sprue. Those are some of the names that are associated with gluten intolerance. There's another aspect called gluten sensitivity, which I'll come back to. And once I eventually get the slides up, I can show you a little more. But basically, here's the idea, is that celiac disease is a real disease. It affects about 1% of the population, so that when people eat gluten-containing foods, wheat, rye, and barley, they have this immune response which causes them to feel terrible. And actually, too, if somebody has gluten intolerance, they also end up with damage to their small intestine in terms of the villi, the little things that help you digest foods. They flatten out. So you have these terrible, terrible symptoms. And then, in addition, if you continue to eat foods with gluten, you can damage the small intestine. The good news is that following a gluten-free diet will treat the symptoms. Yay, we're up. Okay. Here we go. Following a gluten-free diet will treat the symptoms. Now, what is it? Basically, it's inherited disease. And you have to have three things. You have to have the gene for the propensity. You have to eat gluten, and there's usually also some environmental cause that triggers the gene, something very stressful, such as trying to drive home. For me, I'm just going to make a joke here. Driving home in the rain with people from Southern California that don't know how to drive in the rain. No, but seriously, things like a pregnancy or a severe illness can trigger it. So, how do we then diagnose it? I talked about some of the symptoms and the fact that they all are not related completely to the gut. Now, the acid test is actually doing blood work. And I'm going to come back to why this is so important to get a diagnosis for this condition. These tests are very, very specific for whether or not you have celiac disease. And the other thing is that if when in doubt, they will actually go in and do a biopsy of your small intestine, showing the flattened villi, indicating that the gluten is damaging the gastrointestinal tract. The second part of the diagnosis is if you follow a gluten-free diet, you get better. You feel really, really good. So the treatment is to avoid these foods, wheat, rye, and barley. Some people even recommend avoiding oats. Now, oats don't have gluten, but there can be some cross-contamination in harvesting that can actually cause people to react to oats as well. And basically, the diagnosis is proved when the person follows a gluten-free diet and they get better. Now, let's talk about what a gluten-free diet will not do. A gluten-free diet will not cause you to lose weight. A gluten-free diet will not cure hyperactivity. A gluten-free diet will not, some of the claims I've seen for the gluten-free foods just blow my mind. So in other words, it is, right now, the whole gluten-free is kind of a fad. It's a real disease, but only 1% of the population have celiac disease or gluten intolerance. And you have some unscrupulous folks claiming that if you eat eat gluten-free foods, you can be cured of all these ailments, arthritis, cancer. Anytime you hear a fad thing, it usually claims to cure at least 3 diseases, right? So you get a little suspicious. Now there's a more interesting component of this whole situation in that there is now being recognized a syndrome called gluten sensitivity. Gluten sensitivity is not gluten intolerance, because in gluten sensitivity, when they look at your blood, your antibodies are all normal. If they go as far as to take a small bowel biopsy, that's normal. And yet these people can end up with these people can follow a gluten-free diet and feel good. They can have symptoms similar to gluten intolerance, gastrointestinal symptoms, just feeling lousy, and they go on a gluten-free diet and wow, they feel great. So what we're realizing is there's this huge, broad spectrum of gluten intolerance, gluten sensitivity. Gluten sensitivity may affect as many as 10% of the people in the U.S. So it is, it's a real concern. But again, here's the issue. You don't want, if you're feeling rotten, you don't want to go out and put yourself on gluten-free foods without knowing whether or not you have celiac disease or gluten sensitivity. We need to rule out other diseases if you're feeling that bad. So before following a gluten-free diet, you want to get a diagnosis. As I said, it's pretty straightforward with the blood work. Then you go on the gluten-free diet. In some cases, they rule out gluten intolerance, and yet the person comes back to the gastroenterologist and says, "Doc, I feel great. I've been on a gluten-free diet for 3 months," and the doc says you have gluten sensitivity. So, we don't exactly know how to diagnose it, but we do know that if you're feeling better eating this way, then do it. But get the diagnosis first. My other comment is, please do not believe all the claims that gluten-free diets cure all these ailments. They don't. The other question I got a lot of requests for was about calcium supplements. And basically, which form is the best absorbed? The form that's best absorbed is called calcium citrate, or Citracal is one brand, and it's the best absorbed. Calcium carbonate is not as well absorbed. However, calcium citrate only has about 21% of it is calcium. Calcium carbonate, 40% of it is calcium. Why is this important? This is important because calcium citrate is a heck of a lot more expensive. And calcium carbonate, your good old Tums, everybody thinks of, oh, Tums, that's an antacid. Yes, it's also a calcium supplement. And guess what? When you sell calcium as an antacid, it's cheaper than when you package it and call it a calcium supplement. So if you want to save money, folks, go out and buy Tums. If you're going to take a calcium supplement, that's what I recommend. I have no affiliation with any of these products, but I just want to point out, for people that for whatever reason do not absorb calcium carbonate well, we might have them take calcium citrate, but carbonate is fine for most folks. The other thing to keep in mind is that the body cannot absorb more than 500 milligrams of calcium at one time. So if somebody is supplementing with calcium to get up to, say, 1,200 milligrams of calcium per day, they should not take more than 500 at one time. The other thing to consider when you're looking at a supplement is you want to look at what is called elemental calcium. Calcium carbonate is 40% calcium, for example. So if you're taking a tablet that says 500 milligrams of calcium carbonate, it will list 200 milligrams of elemental calcium. Follow me? So it's the elemental calcium that you want to think about. So do not at one time take more than 500 milligrams of elemental calcium. Are there supplements that interfere with calcium absorption and vice versa? You don't want to take iron and calcium at the same time because they compete for absorption. So those supplements should be split up. In some situations, you don't want to take calcium and certain prescription drugs at the same time. That's something I would have to go back and look up, but generally, if you have a prescription drug, the pharmacist will actually tell you, do not take this with a calcium supplement. Don't take more than 1,200 milligrams per day. The other thing to keep in mind is that, you want to take, if you're going to supplement with calcium, first take a look at how much you're getting from food. Most people are going to get some calcium from things like yogurt and cheese, cottage cheese, etc. So it's, we don't want people to meet the recommended intake for calcium completely with supplements. We take a look at how much you're consuming with food first and then supplement with the calcium on top of it. Now, more important than calcium, I always am surprised about this because everybody thinks calcium. What do you think of when you think of calcium, people? Why would you take it? All right, there's an even more important nutrient. Anybody know what that is? Vitamin D. Give the woman a t-shirt. I think that was a woman. No, I can't. I just heard a voice pop up. Vitamin D is critical. Vitamin D is actually far more important for bone health than calcium is. And we actually have a vitamin D deficiency in this country. Why? Well, a couple of things. One, we're not spending as much time outside. As a nation, we're fairly sedentary. Two, we have pollution, which prevents some of the ultraviolet light. Our bodies can make vitamin D, but we have to be out in nice, bright sunlight for 20 minutes a day to make a significant amount of vitamin D. So you're looking at, air pollution, and, well, not here in Irvine, but in Riverside there is. So you're looking at pollution, you're looking at people not going outside as much, and probably the number one reason, people don't want to get skin cancer, which is great. That's awesome. So they cover themselves like, look at me, talk about, I've already had skin cancers lopped off. So I'm using sunscreen, and I'm trying to, cover my face and wear long sleeve shirts and things like that. And yet, lo and behold, I've just completely eliminated my vitamin D production by doing that. So we do have a vitamin D deficiency. Deficiency in children is associated with rickets. It's where the legs bow. In adults, it's associated with basically the beginning of osteoporosis, osteopenia, and eventually osteoporosis, and also bone fractures in adults. So vitamin D status is critical. Vitamin D, in fact, it's a hormone as well as a vitamin. And there are effects, I'm way ahead of myself here, there are other areas where vitamin D has health effects. Specifically, we now know that high levels of vitamin, or adequate levels of vitamin D in the bloodstream help to protect against certain kinds of cancer. Colon cancer being one, breast cancer, perhaps even prostate cancer. Acceptable vitamin D status also helps to reduce the risk for developing high blood pressure. So these are not, things that are related to the bones. And there's also emerging evidence that vitamin D, is involved in autoimmune diseases, things like multiple sclerosis. So that having adequate vitamin D status can reduce your risk for autoimmune diseases, which are really nasty, by the way. So how do you know whether or not you have enough vitamin D? Basically, go to your doctor and ask for a blood test. And this is where we have some controversy. We have the Institute of Medicine, those are the folks that come up with our our dietary reference intakes for how much we should be consuming per day of vitamin D and other vitamins and minerals. We also have a group called the Vitamin D Council, which has done a lot of research in the area, nonprofit. They've done a lot of research in the area of vitamin D metabolism. The Institute of Medicine says that depending on the blood test, you want to be 50 millimoles per liter or higher. Well, the Vitamin D Council says no, if you really want to optimize health, I mean, there's a difference between preventing a deficiency and optimizing health status. So the Vitamin D Council is saying we want to optimize health status, so they believe that using the millimole per liter measurement, that you have 70. Now, how much do people need to take as supplements? This recommendation comes from the Vitamin D Council, not from the Institute of Medicine. The Institute of Medicine grudgingly increased the dietary reference intake for vitamin D from like 400 IUs for most of us up to 600 IUs. And many health groups, including the Vitamin D Council, feel that that is still too low. So supplemental vitamin D, you may have to take about 1,000 international units per day to get yourself up to an optimal level of vitamin D in the blood. And again, don't just run out and buy vitamin D supplements and take them. Find out what your vitamin D status is. Get the blood work done. I know this is now twice. I'm like, go to the doctor, get checked out. As a point of interest, basketball players, predominantly, at least the Lakers, predominantly African American. A lot of them have low levels of vitamin D in their blood. They're inside all the time. So, and the problem with them is, if they get a stress fracture, they're out. So, I mean, this is an important nutrient, not to mention all of the other, not just bone health, but the other potential health benefits. The highest source of vitamin D in the diet is fatty fish. I'm going to come back to why fatty fish is so lovely for you in a few more slides. Most of the vitamin D in our diet comes from fortified foods. Milk is fortified with vitamin D. Yogurt, they're making yogurt higher in vitamin D as well. And you can even find other foods that are vitamin D fortified. So, but just keep in mind, for bone health, yes, calcium is important, but vitamin D is more important. And not only that, your vitamin D status has importance for preventing other diseases as well. So, we kind of almost have a pandemic on our hands here.
Can you take too much vitamin D?
Yes, which is why, first of all, you don't start supplementing until you get the blood test to find out where you are. And 1,000 IU is not high. When somebody's blood level of vitamin D gets up to like about 125 to 150 full millimoles per liter, that's too high. Just so you know too, when somebody is deficient, when their vitamin D level is low, they're put on huge doses of vitamin D to bring the level back up. And you have to be on those doses for 3 to 6 months for it to be effective. So the good news is that vitamin D toxicity is not as much as a problem as we used to. We used to think, if you supplement with vitamin D, you're going to have vitamin D toxicity, vitamin D overload. That's not as much of a problem. It's a big concern with vitamin A, but vitamin D is, there doesn't seem to be the issue. Which notice too, I'm saying that let's say that you're a little under 50. We'll use the more conservative guideline. Well, in my case, if I'm a little under 50, I'm going to take 1,000 international units of vitamin D a day. That's below what we call the upper limit. It's not a dangerous amount. And then I'm going to go back in 6 months and get another blood test and see where I am. And I also would, by the way, eat the foods that are high in vitamin D, like the fatty fish, which also, as I'm rolling along here, you'll see have some other health benefits as well. In my case, unfortunately not being a big fish fan, I go for more of the vitamin D fortified stuff like the yogurt and the non-fat milk. Great question that I love getting this one. How healthfully do I really have to eat? I mean, come on, folks, let's be realistic. All of us want to have a junk food allowance. You know, we want to know, all right, if I'm going to eat all these fruits and vegetables that you're recommending that I eat, that's fine, I'm happy to do it. But if I do that, can't I, and I'm not going to use the word cheat because I don't believe in that expression, but, you know, if I'm eating well, can't I allocate some of my calories to foods that don't provide any nutrients? Well, okay, the answer is yes, you can eat some foods that don't provide nutrients, but before we go there, let's back up to what is eating healthfully? We've got several definitions of it. And basically what we look at now in the nutrition arena, we don't talk about a diet per se, we talk about healthy dietary patterns. So it's a pattern of eating as opposed to a diet. And the pattern of eating that is healthy really emphasizes plant foods, fruits, vegetables, whole grains, legumes, you know, beans, nuts, seeds, limited amounts of meat and things that contain saturated fat, non-fat, low-fat dairy products, limited use of added fats, and limited use of added sugars. I mean, in a nutshell, that's it. The guidelines that the U.S. puts out with the 210 dietary guidelines, they finally came up with the choose my plate visual, which I really like because it's a lot simpler to follow than the stupid pyramid. The pyramid started good, and then when there were like 13 little hatches in it, I'm an RD, folks. I have a master's degree in nutrition, and it drove me crazy trying to figure it out, trying to explain it to clients. So this is very, very straightforward. And in fact, before when I've talked to you, I talked about the American Institute for Cancer Research, their Healthy American Plate. They first started with the visual idea of the plate. Finally, the government got on board and did the same thing. But you'll take a look and notice that grains, fruits, and vegetables are supplying the preponderance of calories. That's what's recommended to be healthy. And let's look at a diet that people have been following for many, many years that we know is associated with longevity and lower risks of cancer, heart disease, and diabetes, and that's the Mediterranean diet, the people that have this healthy dietary pattern. And again, this is in the pyramid style. This kind of pyramid I don't have a problem with because, look, it's very straightforward. The base of the pyramid is what? Exercise. I'm also an exercise physiologist. And then we move up, and that's the largest amount of food. You know, lots of monounsaturated fat in the case of using olives and avocados, and, you know, whole grains, fresh fruits and vegetables, you know, locally grown, etc. Very, very healthy dietary pattern. So that's another way to go. So back to the fun stuff, which is, okay, I'm pretty much doing that most of the time, Ellen, but all right, get to the point. How many empty calories can I have? Empty calories are primarily from what we call solid fats and added sugars, and they don't provide any nutrients along with their calories. So can people eat some empty calories? Well, of course they can, but the problem, again, most Americans, nobody in this room, I know, you folks are awesome, most Americans eat too many empty calories. So there is a limit to the amount that you know, again, going with our government recommendations here, the 210 dietary guidelines, we want to base the amount of empty calories on total calorie needs. And this is the part where think again on exercise, because that's coming right back into the equation. So I am a female that's over 51 years of age. Now this is if not active. If I were just to sit in front of my computer all day long, I would need maybe, this is an average, 1,600 calories, and I'd have a whopping 120 calories of empty calories. Bottom line, I guess I better not go to Starbucks and get a flavored coffee, right? I'd be done. I'd be over probably double that. And however, whoa, that should be 100 and I blew it. Whoa. I was sitting too long in front of the computer. 160, sorry, not 1600. Yikes. Okay, but yes, now I want to be a female age 31 to 50. But keep in mind, this is based on your calorie intake. So if you're exercising, let's take this now, like yesterday. All right, so sitting around, I need 1,600 calories. Yesterday I did this hike from Palm Springs Desert Museum up to the Palm Springs Aerial Tramway, 10 miles, 8,000 feet. I burned, doing that hike, as many calories as if I had run a 26.2 mile marathon. Can't run anymore because of my back. But figure, about 2,600 calories. Guess what happened to my empty calorie allowance? It went up. So exercising gives you, a bigger M&M allowance, as I like to say. Not to mention all the other health benefits. But if you're like me and you like food, that's just another reason to work out. I mean, I'm addicted to hiking as it is, but it doesn't hurt that it allows me to eat more.
Can you look at the slide? Can you go back? The empty calorie for females 31 to 50 is so high.
That's my mistake. It should be 160. I hit the 1 twice there. It's 160 calories, not 1,100. So in your mind, it's 160. Okay, I blew it. And notice men at every age have higher empty calorie allowance. It's because they need more calories. Just another reason to get ticked off. It's your male significant other. So anyway.
When you say exercise, you mean something more than just
cardio.
Stairs, right?
I'm talking about sustained physical. Okay, the dietary guidelines define the ideal level of physical activity. 30 minutes of moderate intensity activity on most days of the week. If we put that into a calorie burn, moderate intensity is something where in the space of 30 minutes you burn off at least 200 calories. So like walking 4 miles an hour, for example. And most days of the week means 5 to 6. So that's considered active. So this is a group of people that are just sitting around. So if you're doing what we I don't like to use the term minimum, but that's the best I can come up with right now. If you're doing the minimum recommended exercises recommended by the National Activity Plan, then you're exercising 30 minutes 5 days a week. So that would be 200 calories. So that's another 1,000 calories a week that you're expending with exercise. And more is better. That's the other great thing about exercise. So this has to be, beyond walking around your house. The not active people, that's us just, walking from class, walking around, really not doing much.
But should we also get on steep treadmills so that we're actually breathless? We're working our
Moderate intensity is classified as, if you're going to use what's called perceived exertion, rating of perceived exertion, it'd be a rating of perceived exertion of somewhat hard, which means you're sweating, but you can still carry on a conversation. So you don't have to run. I mean, there's all sorts of ways to do it. You can do it cycling. You can do it like in a spin class. You can hop on an elliptical, on a Stairmaster. If you're into running, you can run. If you're not into running, you can race walk. You can do cardiovascular dance type stuff. So there's all sorts of different ways to get in the cardiovascular component. Now, what foods lower blood pressure? Years ago, a group of people at Harvard started looking at, they looked at individual foods that they saw had an effect on blood pressure. They saw things like foods high in calcium were good for blood pressure. They saw that foods high in potassium and magnesium, like bananas, were good for blood pressure. And basically they said, you know what, instead of studying these individual foods and individual nutrients, let's put together a dietary pattern that has tons of fruits and vegetables in it, that's also low in saturated fat and cholesterol, that's low in added sugars, and low in sodium. And that came out to be what they called the Dietary Approaches to Stop Hypertension study. That study came out and found that following the DASH diet, as it's called, lowered blood pressure as much as taking a first-line blood pressure medication. So with diet, you know, if somebody only had to be on one blood pressure pill, they could normalize their blood pressure and not have to take medication. Since then, there have been a whole series of studies on the DASH diet, finding the same thing, you know, finding that the DASH diet helps lower blood pressure. It's also good for lowering cholesterol levels in the blood. It's a healthy diet. So, what does it look like? What it looks like, again, this is going to sound really familiar. Check it out. Basically, you're consuming, you're consuming about 9 servings at a minimum, 8 servings of fruits and vegetables per day. And we recommend whole fruit versus fruit juice because whole fruit has dietary fiber and helps you to feel fuller than if you're just drinking fruit juice. Grains, preferably whole grains. Think back to what I showed you with the myplate.gov slide. And milk is a great source of calcium, which we know we need. Also has vitamin D in it, right? So yes, we want people to drink milk, but let's get rid of the saturated fat and drink non-fat milk or 1% fat milk. Lean meat, nothing wrong with lean red meat. Poultry, fish, and of course, nuts and seeds and beans are also healthy. So this is what the DASH diet looks like. And they have DASH diets for different calorie levels. If you go Google DASH diet, you'll be taken to the National Institutes of Health website, and you can actually download a brochure that gives you, based on your calorie level, which they show you how to calculate, gives you a DASH eating plan based on your calorie level, and the booklet even includes recipes. It's really cool. So again, this is now 3 healthy dietary patterns. We have the myplate.gov, we have the DASH diet, we have the Mediterranean diet. So there are foods you can eat to lower blood pressure, and once again, exercise is essential. Exercise, for years we've known that exercise not only lowers blood pressure, but people who are active throughout their life have a lower risk of developing high blood pressure. Better to prevent it in the first place. I had fun with this one. Mind-boosting foods. Who doesn't want to be smarter, you know? So, basically, the one that came out, and I looked at several resources for this. You know, some are credible, some are not as credible. But the one I really liked, it was actually, you can use that link. It was an article done by CNN. It was a reprint of another article, and the reprint was based on the scientific writer that wrote it actually cited research studies that I could find and go back and check. So that was really nice. You know, so I could validate the accuracy of the information. Berries are fabulous, especially blackberries, but any kind of berry is good. Moving on down. Oh, why? Well, they help reduce inflammation. As we get older, not saying that I'm over 50 or anything, but I already told you that, didn't I? But we get some inflammation going on in our brain cells, and the brain cells don't communicate as well. So by reducing inflammation in the brain, we then improve the ability of the neurons to communicate with each other. So that's pretty cool. Plus, berries are really, really healthy, and they taste good. Dropping on down the line, I really like to see this, coffee. Coffee is a central nervous system stimulant, meaning it stimulates the brain activity. That's because of the caffeine. But coffee also is the primary source of what we call phytochemicals, healthy plant compounds. Coffee is the primary source of phytochemicals in the American diet. Kind of sad. The highest source of phytochemicals in the American diet should come from what's back there that you're having for lunch with all the, the veggies and the fruit and the, the legumes and stuff. But so bottom line being, modest caffeine intake is great. And they've shown that it reduces risk of developing Alzheimer's. Apples, but you want to eat the skin because a lot of the really good stuff is underneath, right between the peel and the apple. They contain quercetin, which helps to prevent free radical damage to the brain cells. Chocolate, especially dark chocolate. Dark chocolate is higher in these phenolic compounds that are beneficial. Polyphenols in cocoa increase blood flow to the brain. Gonna rock and roll here. Spinach, not just good for Popeye. It contains a bunch of nutrients that help to prevent dementia. Extra virgin olive oil. Let's go back to the Mediterranean diet again. Between olives, and by the way, avocados also have some benefits too. Now this is great. I had to actually look this up. I can't oleocanthal. It decreases amyloid B-derived diffusible ligands. These we see in the brains of people with Alzheimer's. So extra virgin olive oil, they have shown this seriously, that this actually does that, which is pretty cool. Cinnamon, it's a nice spice. It may also have health benefits. It contains proanthocyanins and cinnamonaldehyde, and these inactivate tau proteins, and you get tangles of these proteins in the brain with Alzheimer's patients. All this really cool stuff I learned by putting this talk together today. Some of the stuff I knew. I knew berries were way up there. Salmon, fatty fish, highest sorts of DHA. And DHA is an essential fatty acid. That's toward the very end of the talk. I'll come back to that. It's the predominant omega-3 fatty acid in the brain. It's critical, and salmon has the highest amounts. Curry, nice Indian spice, contains curcumin. Curcumin is a powerful anti-inflammatory, blocks inflammation, and decreases the formation of those plaques that we see in Alzheimer's. Concord grape juice, just good old grape juice. Again, very much like berries. It contains polyphenols that reduce inflammation. Another great question, and actually all the questions were really good, but this one was, okay, I'm at work, I'm in school, I want a healthy snack that I can grab right away. What should I do? Well, I always tell people, first of all, you want to plan ahead. You're a lot less likely to run to a fast food joint or go to a vending machine if you have a nice little individual cooler, or if in your office or dorm you have a nice little refrigerator where you can just reach in and pull something out. So plan ahead and have a source for healthy snacks that's readily accessible. And what are some healthy snacks? Lots of stuff. I've talked about how lovely nuts are. I've talked about how great fruit is. You can go with dried fruit. Just stay away from the sweetened dried fruit. Like Trader Joe's, I was in there. I love their dried mango that doesn't have any sugar on it. It's a little chewy, but it's great. So dried apricots, things like that, raisins. Some of the obvious things are like the breakfast bars, granola bars. This is where the refrigeration comes in, is going with yogurt, fruited yogurt. And you can also, now that we have the packets, you can get those little packets of that have like packets that have chicken and turkey and water, so they stay good for a while. That's a good choice. So these things are easy. Oh, and they're not expensive. And hard-boiled eggs. Hard-boiled eggs have really received a bad rap over the years. Eggs have the highest quality protein in the American diet, next to whey protein. Eggs are great, very filling, and and most people can eat an egg a day and it will not have any effect on their levels of blood cholesterol. What about eyesight? And this is going to sound very familiar to the brain boosting foods, but let me start by saying that they did a study on giving people who had the beginning of macular degeneration, they gave them a supplement containing these different antioxidants. And they found that it reduced macular degeneration, so vitamins C, E, and zinc. Now, what they also found out is that people that had healthy eyes to begin with, the supplements didn't do anything. But people who already had pre-existing macular degeneration, it slowed the progression. Now, diets high in lutein, and notice I say diets here and not supplements. Every time I walk into a health food store, I see a lutein supplement, I'm seeing a zeaxanthin supplement. These foods, things like kale, spinach, turnip greens, romaine, broccoli, and Brussels sprouts, help to reduce cataracts as well as the risk for macular degeneration. So, plus let's go back to fish. Fish just keeps popping up. I wish I were a bigger fan. Fish is high in omega-3 fatty acids. Not only does it reduce macular degeneration, it protects against cataracts as well. And as I noted, supplements do not have the same protective effect. If you're healthy, you run out and go buy yourself an eye supplement, it's not going to do anything for you. Again, what do we want to do here? We want to prevent it. How do we prevent it? We prevent it by consuming lots of fruits and vegetables. Eating more vegetables, healthy dietary pattern, that's more important than walking out and buying 5 pounds of broccoli and eating that over the next week. Also, here's the other beauty of it is the same diet that we're recommending that's healthy, that prevents heart disease, that helps to prevent certain types of cancer, that enhances your brain function, that protects your eyes. It also helps to prevent heart disease and atherosclerosis in the blood vessels. And the blood vessels to the eyes, if we can keep those open, that's going to help. Diseases like coronary heart disease, where you have atherosclerosis in the coronary arteries, and diabetes, which increases the risk of developing heart disease. One of the big things diabetes is associated with, as is eye damage, because it damages the blood vessels, the little tiny vessels that supply the retina. So a healthy diet, you're getting, not only are you helping your eyes, you're getting all these other benefits as well.
Can I ask a question about the spinach?
Yes.
I like raw spinach and I don't like whipped spinach. Does that make a difference in the benefit?
No, raw spinach is fine. I'm with you. I'd rather have raw spinach in the salad. If you cook it, you have to do something with it, put vinegar on it or something. I could be really evil and say put bacon grease, but no, seriously. No, seriously, raw spinach is great. You do not have to cook it. So, once again, you're going to be like, I think I've seen this before. I think I've seen this pattern before. It's the same, it's the same speech I've been giving throughout the entire session here. And moving to the end, omega-3 fatty acids, what are they? They're essential fats. There are 3 types of them: eicosapentaenoic acid, docosahexaenoic acid, and alpha-linolenic acid. And they're very highly unsaturated. We have to have them in the body. Basically, the primary source of alpha-linolenic acid is plant foods. So vegetables, nuts, vegetable oils. Walnuts are the highest source of alpha-linolenic acid. So nuts have the most alpha-linolenic acid of any nut. Dropping on down here, where do we get the other 2? We get them from fish. Now, we know from the Heart Association, they put out a science advisory, and they basically said, we know that fish, as well as fish oil, reduces the risk of heart disease and death and the progression of atherosclerosis. These oils are very anti-inflammatory. They help to dilate the blood vessels, and they help to prevent blood clots. So they, are less likely. I mean, when you think about somebody having a heart attack, it's because a clot forms in a narrowed artery. Well, if you can keep the clot from forming in the first place, that's a good thing. Now, what else do they do? I mean, the primary benefit we know is for a healthy heart. There are other benefits as well. Back to the brain. DHA is a critical fatty acid in the brain. And in fact, this particular fatty acid is needed. This is a really, I just learned this in the past year, by the way. This fatty acid is used to produce something called resolvins. Resolvins resolve inflammation in the brain. Remember I said as we get older that there's more inflammation and the neurons don't communicate as well? Well, DHEA helps to prevent inflammation via its effect via the production of resolvins. So very, very important. DHA, so what are the recommendations? And this is where I lose out. The recommendations are consume at least 2 servings of fish per week and include foods and oils rich in ALA. So I do the second part of this, but not the first part. Individuals with heart disease after consultation with their physician actually can take supplements. But, my being a food-first dietitian, I'm recommending you don't have heart disease, go out and eat foods that are high in omega-3 fatty acids. Don't go buy the pill. Plus, not only you're eating the food, you're getting other benefits from eating those foods that you won't get in slugging down a capsule that has fish oil in it. And that's pretty much it. So